Welcome. Welcome to Consumers Doc 1, Dr. Bengala. I've been lately talking quite a bit on the healthcare. Today's topic is, folks, it's a very interesting topic, and I'm sure you have heard of it. Surprise medical billing. Surprise medical billing. They need to be banned, man. Time has come. The medical billing needs to be completely be stopped. There should be a way to pay as you get the care. There is a way how to get paid for the medical professionals and facilities as they receive the care. Yes, there are ways, folks. It's this medical billing is hurting a lot of folks, and especially the lower income and middle income families. They get surprise medical bills, and it's destroying folks in the lower income and middle income families, especially when they are uninsured because of their whatever, they don't buy the insurance for whatever the reason is. But I'm sure we can solve that problem. But first we need to total ban on medical billing. There are ways to do it, folks. There are ways. As a consumer's doctor, I've always been a staunch supporter of the consumer, and I believe yesterday I spoke about deductible health plans, high deductible health plans with health savings. That's the way to go. That's the way to go. Even if you're an individual or a family, you're employed by a small business, large business. Do you have any idea how many people who work for mom and pop businesses, they don't have health insurance? This is one of the I would say sad situations. All the doctor's offices, I'm telling you, all the doctor's offices, restaurants, mom and pop stores, none of the employees have health insurance. And when they get into a situation, they get into an accident, whatever the reason is, sudden, unfortunate things happen. When you go to the hospital and they get discharged, they get stuck with a large bill which they can't afford. They don't have any resources to pay. What I'm trying to suggest is high deductible health plan. If the insurance companies are there listening, they need to do a risk fragmentation, folks. Risk fragmentation is if you're healthy, you're in well category. They're only 12% of the claim. 60% of the Americans are healthy. They should not have more than $50 a month in premiums. I'm not kidding, man. At risk, people who smoke, don't take care of themselves, obesity, hypertension, they should be 10% premium more. Chronic illness, the one where people have the largest claims. Almost 50% of the claims in the United States are chronic illness category. Their premiums have to be based on the claims. As simple as that, folks. And finally, the catastrophic, people who have high-risk jobs, they should have a catastrophic. Their claims are only 12% again. Their premium should be a lot lower. If the insurance companies do that and lower the premiums on health insurance, then customers, consumers, clients, they can put money aside into the health savings accounts. That is like an IRA. It's better than IRA. Better than IRA. Yes, I'm telling you guys. All of you out there listening, participate in health savings accounts, which goes into your own account, HSA bank. Then leave portion of the money there, and rest of it is invested into Ameritrade HSA. So if you go to dollarcare.org, go under the service section, fill up the form, open an account on health savings, and pull the money out and put it into the Ameritrade HSA, which appreciates every year, every year. This is for businesses, especially for people who are in the low income bracket. I know it is hard, but if they can put money at $10 a day, I'm not asking a big amount, $10 a day, $300 for an individual, and $3,600 for the yearly. Whereas for a family, $20 a day, $600 a month, $7,200 every year. Put it into the HSA. Contributions are tax deductible, appreciations deductible, withdrawals are deductible as far as you do it for health. Folks, this is a bright future ahead for America. If the consumers control the healthcare, they can shop for healthcare. They can pay cash they can pay through their debit card. And when you go to these facilities, very first thing they ask you, do you have insurance? I said, I don't have it. I don't have the card with me, but I said, well, how much is it? I want a full transparency healthcare, folks. If you're paying cash or you're paying through your card, it's a 30 cents and a dollar. Yes. It's a lot cheaper, folks. Even the CT scan, imaging studies, all the MRIs, they're not thousands, they're hundreds of dollars. $300 you can have a CAT scan, an MRI. I'm not kidding. You can do it. It can be. If somebody doesn't do it, you can go and shop around. I'm sure they're out there. And Healthcare Blue Book gives you the actual costs by the zip code for every procedure. Yes. Follow me, folks. Continue to follow me. I'll continue to explore brighter future into the healthcare for all Americans. We would like to make America as the number one destination for healthcare. Yes, if consumers control it. Look at Amazon. Look at Google. Without consumers, there's no Google, there's no Amazon. I'm sure healthcare should be in the same category. We should be number one. Thank you for listening. Goodbye. God bless. Follow and subscribe to this channel, folks. Subscribe, share, make some comments. I love you because I don't emphasize to the fact you have to subscribe. We can come up with some sponsors, and everything is going for a non-profit anyway. So we will see you in the next episode. Goodbye.